Welcome to episode number 187 of CXOTalk. I'm Michael Krigsman. Our guest today is Mayur Gupta, who is functions as the Chief Digital Officer of Healthgrades. And our conversation is going to be all around digital transformation in healthcare. Mayur, how are you?
I'm doing great. Thanks, Michael. Thanks for having me on your show again.
Well, this is the second time that you're appearing on CXOTalk, and I'm so excited to talk about healthcare and to talk about digital transformation because it's something that affects all of us on a very regular basis. So tell us about Healthgrades and tell us what you guys are doing.
Sure, I'm still very nascent in this world of healthcare. Obviously, as a consumer, we all have touched it in many different forms and shapes. But before I share a little bit about my company, one of the things that I've always heard about healthcare is that it's so far behind and it's increasingly slow, which is almost an oxymoron, but it's true. But in the last 12 months, if there's one thing I've realized, having been in many different verticals, from retail and CPG and finance as well, the healthcare industry may certainly be far behind, but by no means is it slow. I think because the bar is so low, it's moving. The velocity of change in healthcare is so much faster, than every single vertical you can imagine. But at Healthgrades, very briefly, we are one of the largest healthcare platforms. I call them the healthcare marketplaces, where we get around 400 million visitors every year, almost a million a day, who are coming to look for the right doctor, the right hospital. And what we provide to them is an always-on patient engagement that drives them through their healthcare journey. And in many ways, enabling this notion of consumerism, where for the first time you're putting the consumer at the center and enabling and inspiring the consumer to be the owner of her own health and her family's health. And the way we do that is we leverage a lot of quantitative and qualitative data across medical, clinical, and socioeconomic and behavioral data to enable the users to find the right doctor, the right hospital, and resolve issues around discoverability and accessibility. So by making online appointments for you and your family. But then at the same time, we are now evolving ourselves into an always-on patient engagement. So we help you manage your appointments. We help you get prepared for your appointments. We help you manage your journey even beyond appointments to drive, better health outcomes. So it's a fascinating opportunity and journey, and we sit right at that intersection, connecting the consumers to the right provider. And we also have a B2B2C model where we work with around 600 hospitals in the country, leveraging our data science, creating predictive models where we use to predict around 160 plus health conditions. And the way we use that is our whole effort is to drive better health outcome by engaging consumers higher up in the funnel. So how do we prevent somebody from going into an ICU? By predicting their potential health condition and driving the right messaging through whichever channel they may be engaging on, and driving a certain behavior. So it's a massive opportunity, and like you said, it touches every single human being on this planet.
I want everybody to know we're talking with Mayur Gupta, who is the Chief Digital Officer for Healthgrades, and we're talking about change in the healthcare industry that affects all of us. And while we're talking, there is a tweet chat going on with the hashtag CXOTalk. So, Mayur, so the changes that you're driving, empowering healthcare consumers, giving them access to information about their conditions, about doctors, about hospitals. Why is this so fundamentally important? Why don't we consider you to be, well, this is just a nice consumer website, but why does this actually really matter in the end?
Yeah, I think there are two broad reasons, Michael. I think, and this is obviously a lot of it is very potent, in our country here in the U.S. But two big reasons. One is if you look at the dynamics in healthcare and what's going on in the country today, the cost of care is dramatically shifting to the consumer. Deductibles are going out of the roof. At the same time, the networks, are becoming far more narrow. That's on one hand. So the economics and the business model for the healthcare industry is dramatically evolving, and with new policies and new law like ACA, a big shift is happening where the focus and incentivization model is shifting to the quality of care as opposed to the volume of care, and that's a fundamental shift because for the first time, we are starting to hold the providers, the physicians, and the hospitals accountable for the quality of care and for the outcome, as opposed to just the number of people they treat and how often they treat them. So that's, on one hand, that's driving this fundamental shift because now you are being held accountable for how healthy you are, as opposed to how well you treat when somebody falls sick. So it's a shift from sickness and treatment to health and wellness. Two, the other big shift is, look, and again, this is healthcare agnostic, this is industry agnostic. We used to be operating in a world, in an era of the brand, then we all evolved into an era of the retailer. We all know we are by far living in an era of the consumer. It's the same consumer that is used to, I often say, click a dash button from Amazon to order their next supply of Clorox that they expect in 4 hours. It's the same consumer that uses their Uber app to expect, a car waiting for them outside their house within a 1 minute period to go wherever they want. That's the same mom who's saying, look, I can do that. I can use an Airbnb to find the right house, book that house in a span of 10, 15 minutes, 7 seas across. I don't have time now to go into a hospital, wait for 3 months, to make the next appointment for my kid. She's raising the bar in terms of convenience, in terms of instant gratification, in terms of getting the value and the experience, and for something that is so integral to her and her family.
And what does this do to the relationship between patient and, I was going to say, the healthcare provider, but it's not just the doctor, it's the doctor's office, it's the hospital. So how does this change the relationship between the patient and the healthcare system?
It's redefined it. It's redefined it at so many levels. And again, this is not scientific. If you look at how we all operate as well, taking our kids to the doctor, it's redefined it in a way that, back in the day, hospitals would be fine just focusing on driving volume or acquisition, to now with so much power, control, and choice that is going into the consumer's hand, there is no such thing as loyalty, because the barrier for me to find the right doctor, the right care is diminishing. I can choose and find the right doctor based on actual quantitative data. Not just because my parents were going to that doctor, not just because my whole family has been to that hospital, or many times, you usually go back to the hospital where you were born. Now you're looking at, wait, I'm looking for a primary care physician. I'm looking for an oncologist. I want to look at not just your degree. I want to look at, how many surgeries have you done? Not throughout your career. How many surgeries have you done, especially in the last 6 months? How many of those actually went through complication? What was the mortality rate? What was the success rate? The fact that all this information, very similar to how you shop for a television or how you shop for an airline, is not available on your fingertips, the bar to engage and build the loyalty and lifetime value for that patient is so much higher, which means that hospitals and health systems have to realize that, one, they are now living and operating in a digital world, which means they cannot look at digital as a thing. They have to realize it's healthcare in a digital world now. Two, they have to fundamentally evolve and not put the health system or the provider at the center, but literally put the consumer at the center, and understand that the goal of that consumer engagement and relationship is no longer about the clinical output. It is about convenience, it is about experience, and it is about the overarching value that she expects, as the end consumer.
So how much of this is driven by need for change in the healthcare system, and how much of this is driven by as you mentioned earlier, the broader shift towards a more consumer-centric approach that brands in general have with their customers and potential buyers?
I think it's both ways. It's no different. It's a movie being replayed all over again. It's a transformation we've seen in finance. It's the transformation we saw perhaps 10, 11, 12 years back when we had the flurry of multi-channel players and e-tailers and the Amazons and and the Facebooks of the world. We're going through the same transformation, and that's the fun part. This is not invention or innovation. This is purely application of the same principles, the same best practices, the same platforms, the same technologies. And to answer your question, I think it's a transformation that is inside out as well as outside in. It's a mindset shift. So that the economics are evolving. A lot of it is driven, like we said before, as the policies and the law has evolved, trying to change the state of healthcare. And just to give you some context, the state of healthcare, United States of America spends more money on healthcare than any other country in this whole world. And the largest cause of death in our country, believe it or not, the second largest cause of death in our country is still medical care gone wrong. And normal citizens like you and I perhaps don't look at that or are not aware of that fact. But if you apply that, you'll understand that the transformation now in healthcare has to come from every single aspect of the ecosystem. And I think the protagonist of the transformation is no longer the government, no longer the hospital, it is the consumer. She's finally pushing the envelope. That's when a site like healthcare.gov goes down and there's a fiasco. The consumer is no longer saying, hey, that's healthcare. I give you the benefit of the doubt. You can afford to go down and crash. The consumer does not see the channel, and she no longer sees the industry. She expects the same value and the same experience and the agility that she gets from other parts of her life.
We have a question from Twitter, and I'd like to remind everybody again that as we talk, there's a tweet chat going on. Please contribute. You can ask your questions at hashtag CXOTalk. And we have a question from Arsalan Khan, who says that other industries have set up information exchanges. What about data exchange, information exchange inside the healthcare industry?
Yeah. I think that's a great question, and I always look at data as the oil in our world now, and there's nothing more powerful than that. But I think we all know the bigger challenge is not just in having those exchanges, but it also is in how you apply those changes to solve human behaviors, to solve business problems. But to answer that very categorically, I think that journey began, with the implementation, or rather a forced implementation of the EMR and EHRs, a few years back, within the country. And where healthcare is going now is a very strong realization out of research that says that 80% of our health today actually is influenced by non-medical determinants, which means that just the clinical data and having that being available, through many systems that are out there now and pretty pervasive, is just not enough, which means, yes, there is a massive focus on creating the data exchange, but it is no longer limited to just clinical or claims data, which has been the standard for many years. It is now driving convergence and harmonization of that clinical and medical data with socioeconomic data, what you do, where you live, what car do you drive, do you buy, do you rent, what do you eat, what are you reading, what are you watching? And many other aspects. Are you married? Are you single? How many kids, and so on. And I think there's a firm belief that ultimately the ability to predict the right health conditions, the ability to influencing the human behavior towards a better health outcome, is going to come with that universal understanding of that individual. One individual, two, across medical and socioeconomic, and even more importantly, socioeconomic, three, across online behavior, across offline behavior, and that's the power. And that's where, believe it or not, that's where massive amount of investment is going, on the side of players like us, providing the capability on the health system and the hospital side, from the pharma side. And now we are figuring out, how best to leverage and apply the data to deliver more contextual and more personalized experiences and messaging to pharma, and pharmaceutical and insurance and payers are using that to influence insurance rates, for example, and three, in many cases, to drive more predictive and preventive healthcare.
So when consumers have this data, it of course changes the relationship with healthcare providers. So what does it do to healthcare providers? What is the impact on the provider when patients have this kind of data?
Yeah, I don't think we're at a point, Michael, where consumers or patients have access to that data. I think we are in the very early stages where the healthcare ecosystem is just starting to gather the data. Two, they're starting to harmonize and master the data at an individual or a household level. And three, then we are getting smarter about how we leverage and apply it, with cognitive computing, with the IBM Watsons of the world, where as opposed, like I said, as opposed to have reactive ways of treating sickness, you get into more proactive ways of preventing sickness. We are not at a point where the consumer has access to this data. However, what's happening though is the consumer has access to a lot more information, which is the derived form of data. A lot more information to make smarter decisions, a lot more information which is qualitative and quantitative about the doctor, about the hospital. And that's where there's a lot of advancement being made because, again, just another data point, we've seen, that five out of six decisions around choosing a hospital, are actually, would actually be overturned if we gave the right information to the consumer, to the patients, which means that only one of the six decisions or one of six patients actually make the right decision when you're making it without data and without information.
Mayur, so these changes that are taking place in healthcare, we can describe in one way as being an example of digital transformation. Can you place it into context a little bit more broadly? You've had deep exposure to other industries that are undergoing transformation, and so give us the broader context of digital transformation and make some comparisons with other industries as well.
Yeah, I think that's a great point, and obviously we all know digital transformation is sort of a buzzword right now, and we all are used to a new buzzword. I believe one every year. So this is the one that's really hot, but there is some truth in the fact that digital transformation is industry agnostic. It's the same transformation that we are going through on retail, or we have been going through on retail. We are going through on CPG and manufacturing. And we are now starting to go through in healthcare and all different aspects of healthcare. It's not just hospitals or providers, it's payer, it's pharma, and across the board. But I think if I were to summarize digital transformation, I recently read an MIT study that created three broad areas of digital transformation at a macro level, and I'll give you my 2 cents on how do you once you dive deeper, what does that mean in terms of healthcare. But the three broad areas is one, consumer engagement. The first and foremost facet of digital transformation is putting the consumer right at the center, and not just in your thinking, but in your execution, in your operations, in how you define success, what does value look like for you, and who really is a protagonist, of your story. Two is in creating, digitized solutions, which means digital transformation is not about just technology. It's not just about automation. It means redefining your business model. It means redefining consumer engagement and the value you bring, and identifying new channels. So if you're a manufacturer, who's been selling for the longest time and through brick and mortar, is now looking at online, is now looking at e-commerce, is now looking at social commerce or mobile m-commerce, and it is creating those alternative channels. It is trying to be wherever the consumer may be, in so many ways agnostic of channel. The whole notion of omnichannel. And I think that's the second aspect. And third aspect is driving business operations. Again, depending on who you are and what industry you may be in, it could be anything from what GE is doing to automate and digitize the back-end operations within healthcare. It could be what manufacturers are doing with supply chain. It could be with 3D printing. I think all those examples is really the third bubble, within digital transformation. But that's just at the macro level on how you could circumvent and prioritize if you're an organization that's going through this transformation. But I think if you dive deeper, I sort of summarize this in five sort of core pillars of digital transformation. Again, these are applicable to any industry. One, you start with the consumer. Everything, you live and breathe and die by the consumer. And what I mean by that is not just the fact that you want to engage the consumer, but it starts with your understanding of the consumer need, her emotional and functional need at any given point of time, and then building your ability, to meet that need. And sometimes, and perhaps in the future, even before she knows that she needs something. The second aspect, which is very close to something I'm really passionate about of digital transformation, is driving convergence. And it's convergence at many levels. It convergence from a data standpoint. We just spoke about that because, again, agnostic of industry, we all believe we know her as a consumer based on our data, but we really don't because our data is fragmented, either by channel, or by online and offline. So it's how do you drive convergence so that you truly understand her as one individual, as one human being? How do you drive convergence in terms of your technology ecosystem? We often talk about marketing technologies and how big of an industry that's becoming. But the opportunity there is not so much of how many of these technologies you bring, but how well connected they are. Is it really a connected ecosystem? And thirdly, how you drive convergence from a experience planning and engagement standpoint, where you just don't look at the world as digital and physical, or digital and traditional, but truly believe that, look, it's one world that we operate in. Call it digital or call it phygital, doesn't matter, but driving convergence from that standpoint. And I think there are the other facets of digital transformation, including the pace at which you drive innovation, because the bar to innovate has dramatically gone down or just doesn't exist anymore compared to back in the day. I think fourth, I strongly believe digital transformation and running business in a digital world or growing business in a digital world has redefined competition. It's created a new world of what I call ecosystem organizations, from the Amazons of the world to the Ubers to the Aetnas, which are very different from, let's say, a value chain focused organization like a Walmart, where, for example, Amazon is now partnering with Walmart to drive distribution. Who would have thought? Because they were, the biggest competitors. So I think digital transformation has redefined who your competition is and who you partner with. And I think the last is, I would say, is the speed to drive change and the agility, in your entire operating model is the core component of winning and driving digital transformation in any organization.
So what does a digital business look like?
Well, that's a pretty broad and in-depth question. I think from my standpoint, I think a digital business is the one that's pretty much applying these 5 core principles. The one that is truly consumer obsessed and consumer led and consumer driven. And what I mean by that is, I'll give you a very simple example of what I mean by it. It's, the big challenge is, look, the consumer has been at the center of the ecosystem for many decades, but it's only been in theory, right? And the big reason is because we all are operating on a massively fragmented ecosystem. So what I mean by that is, when the CMO, when the CIO, the CFO, and the CEO all have the same, KPIs, they all have the same measure of success. And they are all measured with the same bar, which means the objectives that a CIO is driving is absolutely consistent with the ones that the CMO is driving, or any other person within your leadership suite. I think when you do that, that's when you truly become, a consumer obsessed and a converged organization. And obviously, a digital organization is the one that is not going to be afraid to fail. It's going to invest in driving innovation. It's going to invest in becoming an agile organization that is, I call it an organization that is always on. So you're always listening to the consumer. You're always learning from what you're listening, and then you're always engaging with that consumer, again, with an intent to give her what she needs, even before she knows she needs it.
We are talking with Mayur Gupta, who has the role of Chief Digital Officer at Healthgrades. And you can join us on Twitter. There's an ongoing Twitter chat, and you can ask your questions at #CXOTalk. So Mayur, you presented a framework of 5 points of digital transformation. Now, can you describe the challenges associated with becoming a digital business? It's not just marketing. So maybe go beyond
Yeah.
the hype of being a digital business into what it actually means and why is this so hard?
It's I think two things that I would say, two fundamental areas I would say why it's a challenge, but it's a challenge that we're all in our own ways are trying to solve. Again, pretty much across every single industry. One, because it's a cultural and a mindset shift, right? It's look at the people who are the helm, and not many, have grown up in a digitally intrinsic world. It's when you are my kids, when they grow up, they are the ones who perhaps won't even know the word digital because this is the world we live in. And I think that's a mindset shift where we stop to look at digital as a thing, whether it is marketing or supply chain or or operations, doesn't matter. I think the bottom line is we have to firmly believe that digital transformation is a necessity, and digital is the world we operate in. And it's not about digital marketing or digital health, or digital something else. It is how do we leverage, and learn to operate and win in this space where, like we said before, where we redefine competition, we've redefined the economic model, we have redefined the business model, and most importantly, we've redefined what consumer experiences and value really meant. Where back in the day, the focus was on what's unique about my product. It was all about the economies of scale. We've shifted now towards the economies, of value for the consumer, and that's a massive shift. When the first thing you think about doing, incepting a product idea is about the consumer behavior and the unmet need of the consumer that you intend to fill. I think the second fundamental reason why we are still struggling, because it's not the concept isn't new, like you said before, is just something which is inevitable, which is if you look at any ecosystem across industries, each one of them is massively fragmented. Okay, if you look at healthcare, for example, it's fragmented across so many different individual components. But if you look at from a consumer standpoint, for her, it's a seamless journey. When she expects a technology player or a data player to be able to understand her behavior and predict health conditions. She expects that she seamlessly goes into, is able to actually find the right doctor, is able to make an appointment, go see a hospital. And then the hospital, the physician provides or recommends the right medication, the right drug, and she's able to prescribe to it and so on. And then very importantly for her, she's able to get, the right financial aid and insurance coverage and so on. Right in that journey, which all of us go through every single day, there are 5 or 6 isolated and separated components that are absolutely disconnected, which breaks her experience, every single time. If you look at how in every other vertical, from retail to CPG to finance, how are we really engaging in the so-called consumer engagement? It is very channel isolated. You're engaging her or talking at her, through display, you're talking at her through television, you're talking at her through email and so many other channels. Now we're talking about chatbots. The bottom line is everything that we do in our world is either isolated by channel and touch points or isolated by these different components of an industry. And where we have to go rather quickly is breaking down these silos, driving convergence at the macro level and the micro level, ultimately thinking about the consumer value. And some of the organizations, like I said, like the Amazons, the Ubers, the Aetnas of the world, are the ones who realize it. And they are the ones who are breaking down these silos and the barriers. And hence, they are able to drive much stronger, consumer experience, better and stronger consumer value, and storytelling. Ultimately, that's what drives loyalty. That's what strengthens your brand affinity and maximizes the lifetime value.
So when we put the consumer at the center, we're redefining the reference points by which we conduct our operations, by which we do marketing, by which we think about our products and how we design them and what they do. It changes the silos, the departments, and the communication across departments. So truly a digital business is very far-reaching then, based on the things that you're describing.
Yes, it is, and I think in the digital world we've redefined, addressability. You've redefined the notion of who you are and how well a brand should know you. Right? It's no longer about knowing where you live and the fact that your first name is Michael. What is more important is, do I understand your behavior? I don't need to know you. I don't need to know your first or last name, which also means that we've redefined reach, right? I don't have to wait to have your email address to be able to engage with you or to give you what you really need. I can listen to you from so many different aspects. The new breed of, for example, data management platforms that are for the first time able to converge and match data from offline to online, from first party to second party and third party. We all have one universal GUID that ties what you do, when you go into a restaurant, to when you go and watch a movie, to what you're watching at home, to what you're doing online, to what mails you're getting. It's all in one place. The opportunity now is who's able to tie it together and who's able to apply it, to solve business problems and to solve consumers' unmet needs.
Just so everybody knows, when you say what was the phrase you used, a single or a universal GUID, what you're talking about is a single tracking number, so that as you visit sites, the provider or the vendor knows who you are and gets a more complete picture of who you are, right?
Absolutely. I mean, it's looking I can only imagine, how many of us would have been frustrated the last time we called any 800 number, and when the call, when the customer support representative asked you to fill up a form on the phone, or asked you your SSN and your social, or other information. And again, this perhaps is the same brand and the same organization for whom you probably log in and go online every single day. And that's what it means. And I'm just giving one example on two different channels where organizations would engage with you. But imagine, your behavior when you clicked on an ad and you watched a video, and how that signal is ignored, and the brands still communicate to you as if you never did something. Or when you buy something in a retail environment and you go online, there is no record of that, and hence you don't get your points. So it's the breaking down of those channel silos, and fundamentally understanding you as one human being and tying your behavior, into that, into the context of that single individual.
So this omni-channel experience, which is essentially, to use another buzzword, essentially what you have been describing, provides a lot of benefits both to the consumer as well as to the brand, to the supplier. But I can also hear out there in the waves of the ether, vibrations in the force, people talking right now and thinking about privacy concerns. So how do you balance the privacy aspect against this transparency about the consumer behavior aspect?
Yes, regardless of who you are, I'm sure each one of us is very cognizant about that, and there is a very thin line in terms of how much we should know about the consumer. And again, we are all consumers in our own lives as well, and we often think about that aspect. But my philosophy is very simple. One, obviously, there are some outliers, and there are some clear boundaries that you have to watch out for, and I think we're all aware of those. But at the same time, I look at it from a standpoint that if, as a brand, we are able to create a value exchange system where I give you something in return, a higher value, a better experience, which is more convenient, more effective, then as a consumer, I'm absolutely ready to share a lot more about it. The challenge happens when organizations capture that data and they intrude into my life without adding value for me. Which means that, look, if I'm in the market looking for a car, looking for a Tesla, and Tesla understands that, and they understand that behavior, and now I start to get these ads about getting a great 15% off on a brand new Tesla, Model S, the new shape. Why would I mind that? At that point, I don't mind whether you're sending me a text message or you're sending me a direct mail about it, because it's directly connected to meeting my unmet need at that point in my journey, in my life, and it adds value.
We have a very interesting, intriguing question from Chris Peterson on Twitter, who asks, are there potential regulatory barriers that may prevent the creating of these seamless digital ecosystems across businesses, such as antitrust regulations, for example? And I'm sure in healthcare with HIPAA and other
Yeah.
compliance issues there must be many.
Yes, yes, they certainly are, and I'm by no means an expert, into a lot of those regulations. But we, in all our organizations, we have leaders and experts who are always looking at those aspects. But again, I go back to the same point. I think there are some very obvious areas, and in healthcare perhaps a little bit more than the others, where we know what the boundaries are, where we know that, look, you can, in pharma, for instance, it's very clear you cannot market in a certain way. You cannot market about a drug, without the disclaimer at the end, whether that's a television ad or a print media or a digital ad. But I think at the same time, there is, for me, there's no longer a barrier, because there is so much more that could be done even within the regulations to add more value, to leverage the data, and to start to transform the consumer experience than where we are today. And some industries, the bar is so low, like in healthcare. Very simply, look, giving the consumer the opportunity to be able to discover the right doctor based on smart, quantified, and qualified data is a no-brainer. There is no breach of trust anywhere. If I tell you that if you're looking for a primary care physician, if you move to a new city, or you're looking, unfortunately, for, let's say, an oncologist because somebody in your family, is suffering through cancer, if you had a trusted place where you could find the right doctor, based on that data, based on what the doctor's done in the last 12 months, based on the quality of care in that hospital where the doctor is operating, that's a no-brainer. Two, if I use technology and data now to give you instant access to make an appointment to that physician, that's a no-brainer. This is again the application of the same principles that's transformed and created organizations and companies like Uber and Amazon need to be now applied to healthcare. If we said, look, we would use data to now make healthcare more accountable, which means how do we drive accountability through transparency on the physician side to bring down the number of the amount of death rate in this country because of medical care gone wrong. The reason we don't control that is because people like you and I are not even aware of how many deaths actually happen because of medical care gone wrong. Right? And the same, you can apply the same into payer, into how much you're being asked to pay, which is a black hole till date. But as a consumer, I would demand transparency, especially in a world where you're asking me to pay more and giving me less choices. So if you apply all those things, I think data is solving a very basic human and consumer need, especially in our country.
So we have another question from Twitter, and this is from Scott Allen. Scott's a loyal listener, and thank you, Scott. We appreciate that. And Scott asks, when does using customers' big data become intrusive? When doesn't it add value, or when does or doesn't it add value to their experience?
I think I can rather easily answer that question if I wear my consumer hat and say, anytime my data is leveraged to benefit me as a human being is adding value to my life. And of course, in some cases, I may decide not to take your help, as a brand, whether you're a hospital or a provider or a retailer, that's my choice. But whether it adds value or not has to be determined by the consumer and not by the brand. And that's a big shift. That's a big difference. But I think as long as we continue to understand that, as long as we continue to understand what exactly is your unmet need, whether that is emotional or rational or functional, as an individual, and we are making an effort to meet that need, and you believe in that as a consumer, that's how we'll start to build that trust. That's how consumers will stop to answer that question. Now, having said that, there'll always be a segment, which doesn't believe in that, which is very private. For example, if you are a consumer that perhaps don't have a Facebook page today, then I'm sure you probably are not somebody who likes to share about what you do in your life. You're not somebody who would like to be interrupted, with an ad that is targeted at you. But both of us know, and everybody I'm sure on the show knows, the population that lives on Facebook and how many hours people spend on that platform, which tells me that people are opening up. The community, especially the millennials, the Gen X, is opening up and is open to share as long as they get something back in return and they see the value, they can measure the value. And once you do that, they'll share more.
So the question of value exchange therefore comes back to what kind of information is being requested, what is being offered in return. Does the consumer have given their okay with it, they're accepted this exchange? And is this being done for the benefit of the consumer or strictly for the benefit of the brand?
Yes, absolutely. Absolutely. And it's a journey, right? That's why you will hear many brands aren't thinking just about acquisition anymore. It's all about lifetime value management, because we all know, if the cost of acquisition is high, the cost of retention and loyalty is even higher, or it's invaluable. And unless we bring that mindset shift to think about, the value, the experience we drive from a consumer standpoint, we'll continue to fail.
So we have less than 5 minutes left, and we're talking with Mayur Gupta, who is the Chief Digital Officer for Healthgrades. So in that 5 minutes, I want to ask your advice, Mayur. So number one, share with us advice for how to be a better healthcare consumer. What can we do to get better healthcare?
That's a great question, because I'm glad you asked as a healthcare consumer, because I'm still learning, but my experience at Healthgrades is helping me. I think what I would say is, to be quite honest, as a healthcare consumer, first and foremost is all of us need to start owning our own health, and not leave it to the provider, to the hospital, to somebody else. I think, and we've all seen in other aspects of our lives and how we shop, how we raise our kids, how we educate them, how we travel, that technology and the digital revolution that we're all going through in our lives. And it's not just for businesses. It's, we're living a digital life now, and you can't, we can't run away from it. And for many of you, I'm sure the smartphone is now an extension of your body, and it's not just a device anymore. I think if you're operating and living in that world, we have to raise the bar in terms of our health and wellness, and own it, and challenge the status quo, challenge the ecosystem, demand for that same level of information, choice, and control that we've demanded when you're searching for, for an airline ticket, when you're shopping for a refrigerator. And an average American spends, almost 10 days on an average to search for a car, and we spend less than 10 minutes to search for the right doctor. That's a mindset shift we have to bring, and we have to shift from blaming the system to taking ownership for our own health and for our families.
So take responsibility for your own healthcare.
Yes, because when we do that, and we as consumer become the protagonists, the system will continue to evolve to make it a reality. And I think we now have the infrastructure, we now have the technology, we now have data, and we have now proven it in other aspects of our life. There is no reason why it could not be replicated to solve the healthcare deficit, in our country and all around the world.
And finally, before we go, what advice do you have for people working in companies or for organizations that are facing these kinds of massive changes around them, and they have no choice, they have to dive in, but they don't know what to do, or they're looking at it and it's hard, it's daunting? What advice do you have for these people?
Yeah, I think two things, and this is something that I've learned through my career and I continue to learn. First and foremost is break down those silos, connect the dots, drive convergence in every single aspect of your business, whether that is how you're organized, how you're structured, the kind of talent you bring in, how you look at data, how you look at technology. Doesn't matter what vertical it is, but just drive convergence. We're living in a world that is all about ecosystems and platforms, not about siloed products, siloed technologies, siloed experiences. And I think the best way to think about it is from a consumer standpoint, she does not see the silos. She does not see a channel. All she expects is the best experience, the best service, the best product at the best price, at a location and touch point and a time of her own choice. And the only way we as brands and technologists and marketers can make that happen is when we break down those silos and we drive convergence in our own world, and we stop looking at digital as a thing, because we have to believe that we now live, operate, and breathe in an intrinsically digital world.
I love that. Digital is not a thing. And with that, it's time to draw episode number 187 of CXOTalk to a close. We've been talking with Mayur Gupta, who is the Chief Digital Officer of Healthgrades. And Mayur, thank you so much again for joining us and taking time today.
Thank you so much, Michael. It was a lot of fun. Thank you.
And everybody, thank you for watching. Come back next Friday. We have great shows. Go to CXOTalk.com to see all of our upcoming episodes. And thank you to Livestream for their great support of CXOTalk. Thanks so much, everybody. Bye-bye.